place. Are you familiar with the story that Ms. Harrington did in the Washington Beacon, I think, story that says $39 million worth of NIH funding that could have gone to an Ebola vaccine? Are you familiar with that story?
I'm not familiar with the story, but if you familiarize me on the specifics, I'd be happy to respond.
I'm going to do that. Are you familiar with the fact that $275,000 on a restaurant intervention to develop new children's menu was spent of NIH dollars? You familiar with that? You familiar with the fact that $2 million were spent to encourage the elderly to join choirs? Money from NIH. You familiar with that?
I'm not familiar with the details of grant programs.
$53,000 on a project studying size. You familiar with that? You familiar with the fact that $39 million of NIH funding was spent for all kinds of things that, I mean, I guess, cut to the chase. One of the things you learn in your first economics class, not that I was a great student, but I did study a little economics, and one of the things they tell you is that the term opportunity cost, right? When you spend and allocate resources for one thing, you by definition can't use those resources for something else. And so here's what I think a lot of American people want to know. Why, in fact, did we spend so much money on, for example, $374,000 to host fruit and vegetable puppet shows for preschoolers, when in fact some of this money, as cataloged by the press account and by staff, totaling $39 million, could have been used to help with treatment for something like Ebola and potentially a vaccine? Are you involved in the decisions that NIH makes when they're deciding how to allocate some of that money?
I'm involved in the decisions related to our biodefense and our preparedness programs for emerging infectious diseases. Yes, the NIH, the CDC, the FDA, my office, DOD, DHS, the VA, and the Department of Agriculture all work together on those issues.
But aren't you the point person in coordinating all that?
Yes.
So you're the point. So at some point you have to sign off and say it's okay that $374,000 is used for puppet shows instead of potentially being used, losing the opportunity to use that money to develop a vaccine to deal with something like Ebola.
So with respect, sir, I think you have, I'd like to do a little bit of clarification here. I think there's a little misunderstanding about how the NIH budget is allocated, but that's not my responsibility and my purview. So I suspect we should...
Well, let me go back to that same exchange with Congressman Rogers just a couple years ago when we were reauthorizing the act that created your position and made you the key person. Mr. Rogers says this. You said this when you responded to Mr. Rogers. How can we improve functions at HHS to ensure that you are in fact in charge, that you're the person in charge? NIH is in HHS, right?
Yes.
Yeah. So you're the key person at HHS. How can we improve, Mr. Rogers asked you? You said, I have found through experience that indeed I have the authority that I need to be in charge. You follow up by saying, and I find that the collaboration with sister agencies and HHS, I don't think it has ever been better. We are working extremely close together. I think they recognize and respect the fact that we provide policy direction and are in charge. And I think all the efforts that we have undertaken to coordinate across HHS have done that. So you told Mr. Rogers when we were discussing whether we're going to reauthorize this act, keep your position, that in fact everything was working great. You were the person in charge. You were working within HHS, coordinating policy, direction, and you were in charge and working closely together.
And I would stand by that statement.
So back to the key question. Might we be a little closer to having a vaccine today if you weren't allowing all this millions of dollars, $39 million, to be spent on what many Americans view as questionable uses for their tax dollars, particularly in light of the fact we have an Ebola outbreak in the United States?
Thanks to the investments that we've had in biodefense and our focus and Department of Defense's focus on this critical issue over the past decade, we now have 2 vaccines in safety testing and at the NIH and Walter Reed.
Dr. Lurie, that's my point. Might they be further than safety testing if you hadn't wasted $39 million on a bunch of other things that most taxpayers think are ridiculous? In fact, one of your specific charges is in your, can we put up the second slide? Second slide specifically mentions, this is Ebola, you're supposed to get ready for this. Might we be more ready if you hadn't spent $39 million of hard-earned taxpayer money on puppet shows for preschoolers and instead of invested that in treatment and vaccines for Ebola? It's a yes or no. You can. Yeah. Might we be further along if that money had not been spent someplace and could have been applied to the question at hand?
I don't believe that would be the case.
You don't think $39 million would have helped us get closer to a vaccine?
You know, the development of a vaccine is a long and complicated process. It takes
Is it a costly process, too?
It is, and
it's
takes
a costly process?
years and years and years to do
$39 million could have been used for it. You're the person in charge who works closely to direct policy direction. Those are your words, not mine. Might we have been better off if, in fact, it had been used to develop a vaccine?
I'm not in a position to comment on the overall NIH budget.